The secret medical practices of the Victorian era. Imagine walking into a Victorian doctor's office. The smell hits you first, a mixture of chloroform, carbolic acid, and something you can't quite identify. The doctor greets you with unwashed hands, pulls out a rusty saw, and cheerfully announces he's going to cure your headache by drilling a hole in your skull. Welcome to Victorian medicine. What you're about to discover will shock you. The Victorian era, supposedly the height of civilization and progress, hid some of the most bizarre, dangerous, and downright terrifying medical practices in human history. Today, we're uncovering the dark secrets that Victorian doctors desperately tried to hide. The Victorian era, spanning from 1837 to 1901, was a time of incredible contradictions. On one hand, it was the age of scientific revolution, electricity, railways, and industrial progress. On the other hand, medical practices were often more dangerous than the diseases they claimed to cure. Victorian society projected an image of refinement, morality, and scientific advancement. Doctors wore top hats, carried leather bags, and spoke with authority about the human body. But behind closed doors, Victorian medicine was a horror show of experimental procedures, dangerous treatments, and complete misunderstanding of basic hygiene. Victorian society was obsessed with reputation and respectability. Medical failures, bizarre treatments, and patient deaths were often hushed up to maintain the profession's credibility. Families would rather suffer in silence than admit their loved ones had received questionable medical care. Today, we're pulling back the curtain on these secret practices that defined an era. Let's start with something that seems basic today: cleanliness. You'd think doctors would understand the importance of hygiene, but Victorian physicians were walking disease factories. Victorian surgeons proudly wore their blood-stained aprons as badges of honor. The more blood and pus on their coats, the more experienced they appeared. They would move from patient to patient, from autopsy to surgery, without washing their hands. Surgical instruments were rarely cleaned between patients. The same scalpel that cut open a diseased corpse might be used on a living patient minutes later. Victorian doctors believed disease were caused by bad air or miasmas. They thought illness literally floated through the air as invisible clouds of corruption. This led to bizarre prevention methods. Doctors would wave handkerchiefs soaked in vinegar to purify the air around them. Hospitals were literally more dangerous than battlefields. You had a better chance of surviving a war wound than a routine surgery. When scientists like Joseph Lister began promoting hand washing and sterilization in the 1860s, the medical establishment violently rejected these ideas. They considered it insulting to suggest that gentlemen's hands could be unclean. Victorian medicine cabinets were essentially poison storage units. Doctors routinely prescribed substances that would be considered attempted murder today. Mercury was the Victorian cure-all. Headache? Mercury. Syphilis? Mercury. Depression? More mercury. Doctors had no idea that mercury was slowly poisoning their patients, causing brain damage, kidney failure, and death. The phrase "mad as a hatter" comes from hatmakers who used mercury and gradually went insane. Arsenic was another Victorian favorite, prescribed for everything from skin conditions to stomach problems. Victorian women would take arsenic pills to achieve a pale complexion, not realizing they were slowly killing themselves. Some health tonics contained enough arsenic to kill a horse. Before anyone understood addiction, cocaine was sold as a miracle cure. Victorian pharmacies sold cocaine cough drops, cocaine wine, and cocaine toothache drops, even for children. Sigmund Freud famously promoted cocaine as a cure for morphine addiction, creating a generation of cocaine addicts instead. Laudanum, a mixture of opium and alcohol, was the Victorian painkiller of choice. Mothers gave it to crying babies. Doctors prescribed it for everything from period pain to anxiety, and entire families became unknowingly addicted. Victorian literature is full of laudanum addicts who had no idea why they couldn't function without their medicine. Victorian surgery was basically organized torture. Without proper anesthesia, antiseptics, or understanding of anatomy, surgical procedures were desperate gambles with death. Before effective anesthesia was developed in the 1840s, Victorian surgeries were performed on fully conscious patients. Patients were held down by multiple assistants while surgeons raced to complete procedures before the patient died from shock and pain. The best Victorian surgeons were judged by speed, not precision. The famous surgeon Robert Liston could amputate a leg in under 3 minutes. In one legendary operation, he moved so fast that he accidentally cut off his assistant's fingers and slashed a spectator's coat, thinking it was part of the patient. Victorian doctors revived the ancient practice of trepanation, drilling holes in patients' skulls. They believed this would cure everything from migraines to mental illness by releasing evil spirits or bad humors from the brain. Many patients died from infection or brain damage. Victorian surgeons experimented freely on patients, often without consent. They performed the first risky procedures like tumor removals, heart surgeries, and organ transplants with no real understanding of what they were doing. Success rates were appallingly low, but they continued experimenting on desperate patients. Victorian treatment of mental illness was particularly horrifying, based on complete misunderstanding of psychological conditions. Victorian doctors believed mental illness was caused by stagnant blood in the brain. Their solution? The spinning chair. Patients were strapped into chairs and spun at high speeds until they vomited, fainted, or sometimes died. Doctors thought this would redistribute their blood and cure their insanity. Water treatments were popular for mental patients. This included ice-cold baths that lasted for hours, high-pressure water hoses aimed at patients' heads, and surprise baths where patients were suddenly dunked into freezing water. Many patients died from hypothermia or drowning. Victorian doctors believed women's mental and physical problems were caused by their wandering wombs. Hysteria was diagnosed for everything from anxiety to sexual desire. Treatments included pelvic massages, surgical removal of ovaries, and commitment to insane asylums. Thousands of perfectly sane women were institutionalized simply for being inconvenient to their families. Mental patients were restrained in horrifying devices: straitjackets that cut off circulation, chains that prevented any movement, and tranquilizing chairs that immobilized patients for days at a time. These restraints often caused more psychological damage than the original conditions. Victorian medicine was essentially a giant, unregulated drug experiment performed on an unsuspecting public. Victorian pharmacies sold thousands of patent medicines with secret formulas. These miracle cures contained dangerous combinations of alcohol, opium, cocaine, mercury, and other toxic substances. Families would unknowingly become addicted to their daily medicine. After the discovery of radium, Victorian entrepreneurs created radioactive health products. Radium water, radium chocolate, and radium face creams were marketed as youth elixirs. People slowly died from radiation poisoning while believing they were becoming healthier. Victorians became obsessed with electricity as a cure-all. They invented electrical belts, electrical baths, and electrical chairs that delivered shocks to patients. Some treatments involved inserting electrical probes into patients' bodies. Many people were electrocuted during these therapeutic sessions. While publicly condemning drug use, Victorian society had an extensive network of opium dens hidden in respectable neighborhoods. Middle-class women would secretly visit these establishments for their medical treatments, not realizing they were feeding serious addictions. Perhaps the most disturbing aspect of Victorian medicine was the systematic cover-up of failures and the persecution of reformers. Victorian medical societies protected incompetent doctors and suppressed evidence of medical failures. Doctors who spoke out against dangerous practices were expelled from professional organizations and had their careers destroyed. Families who lost loved ones to medical malpractice were pressured to stay silent to protect the doctor's reputation. Victorian society valued professional credibility over patient safety. Victorian hospitals kept deliberately misleading statistics, hiding their true mortality rates. They would discharge dying patients just before death to avoid counting them as hospital deaths, or blame deaths on patients' weak constitutions rather than medical errors. Every major medical advance was initially rejected by the Victorian medical establishment. Hand washing, anesthesia, antiseptics, and germ theory all faced violent opposition from doctors who preferred their traditional methods. Doctors who tried to expose dangerous practices faced professional destruction. Dr. Semmelweis, who proved that hand washing saved lives, was literally driven insane by the medical establishment's rejection of his findings. He died in an asylum, ironically from an infection that could have been prevented by the hand washing he promoted. The secret medical practices of the Victorian era reveal a shocking truth. Sometimes progress requires admitting that respected authorities are completely wrong. Millions of people suffered needlessly because Victorian doctors were too proud to admit their ignorance. Patients died from infections that could have been prevented with basic hygiene, were poisoned by medicines intended to cure them, and were tortured by treatments that made their conditions worse. Victorian medicine teaches us to question authority, demand evidence, and never assume that professional credentials guarantee competence. The most respected Victorian doctors were often the most dangerous. While modern medicine has advanced dramatically, the Victorian era reminds us to stay vigilant. Medical progress requires constant questioning, rigorous testing, and the courage to abandon practices that don't work no matter how traditional they might be. The Victorian era, so proud of its scientific progress, was actually one of the most unscientific periods in medical history. Their obsession with appearing knowledgeable prevented them from actually learning anything useful. The next time you visit a doctor who washes their hands, uses sterile instruments, and prescribes tested medications, remember the Victorian patients who weren't so fortunate. Their suffering wasn't in vain if we learn from their doctors' mistakes. Thank you for joining me on this dark journey through medical history. These shocking revelations remind us how far we've come and why we must never stop questioning and improving our understanding of health and healing.